Hi guys, my name is Leano and we will talk about dementia. What is dementia? The word dementia describes a set of symptoms that may include memory loss and difficulties with thinking, problem solving, or language. These changes are often small to start with it, but for someone with dementia, they have become severe enough to affect daily life. A person with dementia may also experience changes in their mood or behavior. Dementia is caused when the brain is damaged by diseases, such as Alzheimer's disease or a series of strokes. Alzheimer's disease is the most common of dementia, but not the only one. The specific symptoms that someone with dementia experience will depend on the parts of the brain that are damaged and the disease that is causing the dementia. Later, we will discuss the different um, parts of the brain that are damaged that can cause dementia. Dementia is not a specific disease but is rather a general term for the impaired ability to remember, think, or make decisions. What are the most common symptoms of dementia? The different types of dementia tends to affect people differently, especially in early stage. A person with dementia will have a cognitive symptoms. Um, This will be the following: the loss of memory, or day-to-day memory, for example, difficulty recalling events that happened recently. Next one is concentrating, planning, or organizing. For example, difficulties making decisions or solving a problem or carrying out a sequence of a task such as cooking or preparing a meal. Next one is language. For example, difficulties following a conversation or finding the right word for something. Visual spatial skills. For example, you have a problem of judging a distance or specific distance, such as example, you're climbing upstairs and seeing objects in three dimensions. Excuse me. Orientation, for example, losing a track of the day or the date, or becoming confused about where you are or where they are. Um, a person with dementia will also often have changes in their mood. For example, they may become frustrated or irritable, apathetic or withdrawn, anxious, or easily upset or unusually sad. With some types of dementia, the person may see things that are not really or they will hallucinate, hallucinations, or strongly believe things that are not true or delusions. Dementia is progressive, which means the symptoms gradually getting worse over time. How quickly this happens varies greatly from person to person. As dementia progresses, the person may develop behaviors that seems unusual or out of character. These behaviors may include asking the same question over and over, like restlessness and agitation. They can be distressing or challenging for the person and those close to them. A person with dementia, especially in later stages, may have physical symptoms such as a muscle weakness or weight loss, changes in sleeping pattern also, and appetite and losing and changes in appetite are also common. The types of progressive dementia. First is the Alzheimer's disease. Alzheimer's disease is the most common cause of dementia according for 60 to 80% cases. It is caused by specific changes in the brain The trademark symptoms is trouble remembering recent events such as conversation that occurred minutes or hours ago, while difficulty remembering more distant memories occurs later in the disease. Other concerns like difficulty with walking or talking or personality changes also come later on. Family history is the most important risk factors. Having a first degree relative with Alzheimer's disease increases the risk of developing it by 10 to 30%. Next is vascular dementia. About 10% of the dementia cases are linked to stroke or other issues with flow to the brain. Diabetes, high blood pressure, and high cholesterol are also risk factors. Symptoms vary depending on the area and size of the brain impacted. The disease progresses into stepwise fashion, meaning symptoms will suddenly get worse as the individual gets more strokes or mini strokes. Lewy body dementia, in addition to the more typical symptoms like memory loss, people with this form of dementia may have movement or balance problem like stiffness or trembling. Many people also experience changes in alertness including daytime sleepiness, confusion or staring spells. They may also have trouble sleeping at the night or may experience visual hallucination, seeing people, objects or shapes that are not actually there. Frontotemporal dementia, this type of dementia most often leads to changes in personality and behavior because of the part of the brain it affects. People with this condition may embarrass themselves or behave inappropriately. For instance, a previous cautious person may make offensive comments and neglect responsibilities at home or work. There may also be problems with language skills like speaking or understanding. In mixed dementia, sometimes more than one type of dementia is present in the brain. At the same time, especially people age 80 and older, for example, a person may have Alzheimer's disease and vascular dementia. It is not always obvious that a person has mixed dementia, since the symptoms of one type of dementia may be most prominent or may overlap with symptoms or another type. Disease progression may be faster than with one kind of dementia. Reversible causes. People who have dementia may have a reversible underlying cause such as side effect of medication, increased pressure in the brain, vitamin deficiency, and thyroid hormone imbalance. Medical providers should screen for reversible causes in the patient who are concerning for dementia. Next is the anatomy of and the physiology of the brain. Um, First is the frontal lobes. Frontal lobes are at the front of the brain behind the forehead. This part of the brain eventually becomes damaged in the most type of dementia. They are where information is stored and processed, which allow a person to make a rational decisions and judgment. Frontotemporal dementia is most closely linked to damage in the frontal lobes. Early symptoms of FTD can be changes in personality or behavior. People may also experience difficulty with planning, organizing, and making decisions. Damage to the frontal lobes can make it hard to pay attention for very long, switch between tasks, or do more than one thing at a time. A person with damage frontal lobes may become easily distracted or easily lose of focus, particularly if they are given too much information all at once. The frontal lobes also control interest and motivation. As a result, damage to these parts of the brain may cause a person to become apathetic, lacking interest in things or motivation to do things, much less interested in doing things they have enjoyed in the past. The frontal lobes also control how a person acts in social situation. They may stop a person from saying inappropriate things. Damage to this part of the brain means people with dementia may say things that are hurtful or rude without meaning to them. This can be difficult for people supporting them. Within the frontal lobes is the motor cortex. This deals with planning and movement by controlling muscles. Damage to the motor cortex happens very late in the most types of dementia. Some people experience problem with movement in early stages of dementia. This is normally caused by damage deeper in the brain and not the motor cortex. The cerebral cortex is a thin layer of cells covering the outside surface of the brain. It is responsible for memory, reasoning, decision making, language, and social skills. It controls actions such as moving around or talking, as well as processing sight, hearing, taste, smell, touch, and pain. The lobes of the brain, the cerebral cortex can be divided into four lobes. These are the temporal, frontal, parietal, and occipital lobes. Temporal lobes. The temporal lobes are on either side of the brain, nearest to the ears. Their main roles involve memory processing, hearing, and language. Both temporal lobes stores general knowledge. General knowledge, known as semantic memory, is different from the types of memory that related to day-to-day experiences. The left temporal lobe helps to understand language and usually stores facts and the meaning of words. The right temporal lobes deals with visual information such as recognizing familiar objects or faces. Within each temporal lobes is a region called hippocampus or hippocampus, which processes memories to allow them to be stored and found when needed. Damage to the hippocampus makes it difficult to learn new things. The hippocampus also sends information or important information to be stored in the other parts of cerebral cortex. It is most or it is important for memory of events and experiences. The temporal lobes also helps to understand what is being heard. Damage to the temporal lobes, particularly to an area called the auditory cortex, can make it more difficult for the hippocampus or hippocampus to form memories of what has just been heard. Alzheimer's disease often start in a in around the hippocampus before it spread to other parts of the brain. This is why one of the first symptoms many people notice is memory loss. One is temporal lobes. The temporal lobes are on either side of the brain, nearest to the ears. Their main role involves memory processing, hearing, and language. Um, Both temporal lobes store general knowledge. General knowledge, known as semantic memory, is different from the types of memory that related to day-to-day experiences. The left temporal lobes helps to understand language and usually stores facts and the meaning of the words. The right temporal lobe deals with visual information such as recognizing familiar objects and faces. Within each temporal lobe is a region called the hippocampus, which processes memories to allow them to be stored. Kumbaga, ito yung parang memory card. The next one is parietal lobes. The parietal lobes are located in the upper part of the back of the brain. In most people, the right hand side helps them to understand the position of their bodies and objects in space. For example, it helps them bring a fork to their mouth when eating. The left parietal lobe allows a person to tell left from right, as well as to read, write, and process numbers. Damage to parietal lobes is common in Alzheimer's disease. It can lead to problems with performing gestures and skilled movements, or they call it apraxia. When the person is trying to do things like tie shoelace or put a clothes, it can also make doing tasks that involves reading and writing much more difficult. Occipital lobes. The occipital lobes are located at the back of the brain and mostly deal with visual information. This region processes visual information and makes sense of it, including recognizing colors and shapes. The resulting information can then be passed on to the other areas of the brain. Damage to the occipital lobes eventually occurs in most types of dementia, although not generally during the early stage. However, in posterior cortical atrophy or PCA, visual problems can be among the symptoms. When the occipital lobes become damaged, a person may experience difficulty working out what they see in front of them. Severe difficulties with visual perceptions can also contribute to visual hallucinations, as well as making visual information more difficult to understand. Damage the visual cortex can be contribute to deteriorating eyesight. The hemispheres of the brain. The brain is divided into two hemispheres or halves, the left and right side. Each lobe has a left and right side. Each lobe does different things, but they work closely together. The subcortex is any part of the brain below the cerebral cortex. This region allows fast communication between the different parts of the brain. It also contains some areas that are important for movement, thinking, and emotions, such as the ganglia, the limbic system, the cerebellum, and the brainstem. Um, the basal ganglia are a group of small structures located deep within the subcortex. They are mostly involved in the control of movement. The damage to this part of the brain is common in types of dementia that are also movement disorders such as Parkinson's disease dementia, dementia with Lewy bodies, and Huntington's disease dementia. In dementia with Louis Vuitton, with Lewy bodies and Parkinson's disease, movement can become very difficult, resulting in a very slow movement or a person not being able to move at all. at all times or sometimes. It can also cause involuntary movement, such as a tremor in the hands. Next is limbic system. The limbic system is a collection of regions in the brain that are involved in processing emotions. It includes the amygdala or hippocampus, hypothalamus, and thalamus. Damage to the limbic system is common in most forms of dementia. It may change the way a person feels or would normally react to things. A person may feel more excited, anxious, sad, or apathetic than before they develop dementia. It can also lead them to have delusions, strongly believing things that aren't true. That means delusion. For example, believing that a stranger is in the house or that someone is stealing things from them. The hypothalamus controls levels of hunger, thirst, body temperature, many many of the hormones that controls the body's metabolism. Damage to the hypothalamus may lead to changes in a person's appetite and eating behavior, particularly in frontotemporal dementia. These changes can include craving sweet foods, overeating, or becoming obsessed with particular food. Like my lola, she always requests chicharon. In some cases, in some cases, people may try to eat inedible objects. Um, my lola tried that too, and I think my lola has a dementia because she's already old and 80 plus. Um, let's proceed. On cerebellum, the cerebellum coordinates movements, balance, and posture and helps the eyes to work together. New evidence has shown significant tissues loss in cerebellum in people with Alzheimer's based in my research and frontotemporal dementia. However, few people with this condition seems experience symptoms from this damage. Functional anatomy, disruption of cerebral neuronal circuit, that red part, and the quantity of neuronal loss and location of affected regions are factors that combine to cause the specific disorder. Neuropathology and neurochemical changes. Loss of neurons, neurofibrillary tangles, senile plaque, and amyloid angiopathy are seen, especially within the frontal, temporal, and parietal cortex, hippocampus, substantia nominata, and locus coeruleus. The brains of people with AD have an abundance of two abnormal structures: beta amyloid plaques, which are dense deposits of protein and cellular material that accumulate outside and around nerve cells. Neurofibrillary tangles, which are twisted fibers that build up inside the nerve cells. This was These are the actual AD plaque and the actual AD tangle. Beta amyloid plaques, amyloid precursor protein or APP is the precursor to amyloid plaque. APP sticks through the neuron membrane, and in the second picture, enzymes cut the APP into fragments of protein, including beta amyloid. And the third one is beta amyloid fragments come together in clumps to form a plaque. In AD, many of these clumps form, disrupting the work of neurons. This affects the campus or hippocampus and other areas of cerebral cortex. The next one is neurons have an internal support structure partly made up of tubules rather. A protein called tau helps stabilize microtubules. In AD, tau changes causing microtubules to collapse and tau proteins clump together to form neurofibrillary tangles. Next is the pathophysiology. Presence of symptoms suggestive of dementia, including changes in activities of daily living or caregivers concerns. And under that is perform clinical assessment, including history, physical examination, functional status, and cognitive testing, such as MMSE. Deficits detected on clinical assessment. Perform assessment for treatable causes of dementia, including medication review, depression screening, and laboratory testing. Any treatable abnormalities present? If yes, treat abnormalities and reassess. Do symptoms of possible dementia remain? If no, provide reassurance. And if yes, do the findings meet criteria for diagnosis of dementia? If no, cognitive impairment present, provide reassurance, reassess in 6 months. If yes, consider referral to a subspecialist and or neuropsychologic testing, reassess in 6 months. Um, and do the finding meets criteria for diagnosis of dementia? If yes, are atypical features of dementia present? If no, diagnose Alzheimer's disease, vascular dementia, or etc. If yes, consider referral to a subspecialist, provide close follow-up. The next one, provide counseling about expected course and treatment options. The next one is behavioral intervention and management. Management of dementia. The goal of treatment is to control the symptoms of dementia. Treatment depends in the condition causing the dementia. Next is some people may need to stay in the hospital for a short period of time. Stopping or changing medication that makes confusion worse. There is growing evidence that some kinds of mental exercise can help. Next one is behavioral interventions. Underlying medical illness, correct sensory deficit, remove offending medication, keep environment comfortable, calm, and home-like. Regular daily activities and structures. Educate and support caregivers. Next is medication. The brand name is Aricept. The generic name is donepezil. Classification as acetylcholinesterase inhibitors. Mechanism of action, reversible acetylcholinesterase inhibitors increases acetylcholine concentrations, which in turns to enhances cholinergic neurotransmissions. Indication indicated for the treatment of dementia of the Alzheimer's type. Efficacy has been demonstrated in patients with mild, moderate, and severe Alzheimer's disease. Contraindication, hypersensitivity to donepezil or to piperidine derivatives. Risk of GI bleed, especially in patients with history of gastric ulcer or those on NSAIDs. Adverse effects, nausea and vomiting, diarrhea, insomnia, fatigue, muscle cramps, and headache. Nursing responsibility, monitor for seizure. Seizure may also be due to Alzheimer's disease itself, may be triggered. Monitor GI problems. Donepezils may increase gastric acid secretion, leading to increased risk for developing ulcers with resultant GI bleeding. Donepezil may cause anorexia also. For further explanation, I will play a video presentation from YouTube.
What does it feel like to live with dementia? The experience of living with dementia is often a challenging one. The more people's emotions and perspectives are understood, the better they can be supported. This film introduces 4 people who are able to share their insights on living with advancing dementia, insights that were filmed over time and which were not always easily communicated.
I wake up and I feel afraid to get out. What am I going to face today? What's going to go wrong? Because I've always got this thing in my, well, often get this thing in my mind to say, you've done something, you've broken something, you've lost something, you aren't any good to anybody, why are you here? And I get that a lot.
Oh, it's awful. You get to the stage where you don't want to talk to people in case you repeat yourself.
I couldn't go outside and go to a shop or something. I died. Well, I couldn't do it.
I used to do it all right one time. But it seems to get a bit harder and harder every year. You end up with things like this.
Well, you don't feel as if you're in the world. At least I didn't. I didn't feel as if I was part of the world.
Yeah, I used to have fun.
Makes you feel defeated. What good am I in this world? I'm doing nothing. I'm going to sit down here and be fed and sleep and washed and like an animal.
Let me live.
Barry has lived with dementia for more than 15 years. He's aware of the changes within his life and is still both able to articulate this and, importantly, express how he feels about it.
Well, when I came home last night and I went out, Angie said she wanted a cup of tea. I said, well, I'll make that 1 minute. So I went out and made the tea, but I couldn't remember which cupboard was which. Couldn't remember where the jam goes, where the sugar goes, where's the milk, where's that. And I was out like this for a minute or two. Is this my kitchen? I used to manage butcher shops. I used to run a care home. I used to drive all over the country giving lectures on meat. Here I am, I can't make a cup of tea.
Olive, who has lived in a care home for 2 years, describes her feelings about dementia.
Awful. It's terrible. Because you're hurting the people you love most. Dementia. You really are. It makes you feel very guilty.
Bob has received full-time care for 2 years. He talks about how dementia has changed his life.
In the word, concentration. I can't seem to concentrate on one thing for very long. I don't think you realise how it hits you.
Bob's symptoms include hallucinations and mistaken beliefs, which his wife Sally explains.
When he gets hallucinations, they're extremely real to him. He sees things that aren't actually happening. We've had problems where his room's been on fire and he's had to get out.
Shortly before Bob moved into a care home, there were 2 occasions when he found himself on the roof of his house.
And twice I got up on a roof, walked across the roof of a house. I don't know what made me do it. I That's the difficult part. You can't explain it. All you can say is it happened and you did it. 1 o'clock in the morning. It's quite frightening.
Judy was diagnosed with dementia 11 years ago. She experiences problems with visual perception and is often disorientated.
Where am I here? I know who I am.
Right.
I've got that one down.
Okay. Where are you here?
Yeah, no, where place is this place?
Judy's daughter Karen knows her mother so well that she understands Judy's needs and feelings even when Judy can't find the words.
She wants to express herself in ways that she just can't anymore. She wants to do things that she just can't do anymore. But because she still has a little bit of insight, it makes it really difficult because she still knows the things she wants to do, but she just can't do them.
Why are you sad, Mum?
Oh, looking back.
Looking back?
Yeah.
Why does it make you sad looking back?
Oh, I don't know. Probably I should have done other things. You can't do anything about it. That's the thing.
People can feel powerless in the face of dementia.
Well, it's like a silent illness, isn't it? It's the sort of thing that creeps up on you. Yeah, there is a feeling of loneliness.
But dementia stole in. I had no understanding that there was coming this thing that was going to attack my mind. I had no idea that anything could attack my mind, if you know what I mean. Other people, yes, but not me. It didn't occur to happen to me. And it's just like a persistent spy, almost. Someone who is not recognizable. But his effects are, what he leaves behind him and what he's implanted are noticeable.
Dementia is sometimes portrayed as taking away a person's identity. Judy was asked if she feels this is true for her.
Oh, it doesn't. You are what you are with that. Well, with me, I'll be the same. Exactly the same. No, I'm sorry, it's still me. It's still me. I'm saying.
It's horrible because she was so young, being diagnosed with Alzheimer's, but then, you know, that bits of her do still shine through, and she still is my mum.
Barry is also clear on this point.
Yeah, I'm a man, it's me. And I am me. I'm my wife's husband, I'm my son's dad. And it seems to me that most people, oh, she got dementia. That's sort of like a full stop. End the sentence, end the discussion. She's got dementia, or he's senile.
Supportive relationships with families, friends and professional carers play a key role in helping people with dementia live well.
They're very caring. And I get big hugs from my husband and my children. And that's all right, Mum, you forgot something, that's all. Doesn't matter. Here we are. And then it's all sorted out again.
Well, if you to stay here and help me, and just to be.
Always been friends as well.
Yeah, well, friends before the romance, so I think then you do stay in a loving relationship because the depth is there, isn't it? But he's still the Bob I fell in love with, and I still love. You know, he's still that person underneath everything.
For people with dementia, as with any individuals, empathy and support can help to retain their sense of identity, as well as enhance their well-being and quality of life.
If I could say one thing to somebody who's got dementia or a carer, it would be probably hang on in there, because they really do need you and they have feelings and totally understand what you're saying, and one thing, if I walk into the room and Mum can't see me, she hears my voice within a split second. If I say hello to somebody, she knows that I'm there, and it means so much to them. Hello.